after graduation, like most pharmacists, it's like, what's next? You got license, and now you got to find a real job. So I kind of, like I said, I didn't want to do retail, so I was thinking, what could I do? And so I started applying to different hospitals to be a clinical pharmacist. And so after doing that, I landed a couple of interviews, and then I was able to land my first clinical pharmacist role. And, was really excited about that, nervous, but excited at the same time,
Hmm.
because it just gave a different spin on being a pharmacist, right? Like you said, a lot of people think of pharmacists, working at, the big box. And so I decided, okay, I'm going to go into the hospital and give being a clinical pharmacist a try. And so when I got there, I definitely liked it. I loved the patient interaction. And I think, as a clinical pharmacist, you're really there to, kind of be a sounding board for the physicians to help them care for their patients. You provide, drug information for the physicians and the
Hmm.
nurses. You assess the drug order entries for appropriateness, and you profile those into the patient's profile. You really are just able to engage in dialogue with your colleagues around different treatment options for patients. And so you really are that person in that inpatient setting that really gets to help, tailor the patient's drug regimen while they're there in the hospital during their stay. So.
Man, that's great. That's great. Um, so it's very interprofessional. Sorry about that. I just dropped my book, but that's interprofessional because that's one of the things that the retail doesn't really get to do, right?
Mhm, mhm,
Um, we basically take the order from the physician and
mhm.
then just fill it. So you were
Yeah.
actually able to, were you able to do rounds or really communicate with the physicians and help with the orders?
Yeah, so we had certain pharmacists on different floors, so we each kind of took a floor, and you kind of when you take that floor, it's almost like you take that badge of honor for that floor to kind of know what's happening on that particular floor that you're serving, whether that be with the nurses or the physicians, the patients themselves. So yeah, you really are a part of that interdisciplinary team who gets to kind of round and help make decisions on the patients that are there in the hospital. So yeah, absolutely. You really just kind of maximize that pharmaceutical care for those patients while they're there in the hospital. So you are considered a part of that team. And it kind of goes back to when we're on rotations, right? And we're doing
Hmm.
our internal medicine rotation where you're part of that team, and you really just get to round and follow those patients throughout their hospital stay. And I think it's rewarding because, obviously the patients come in there because they're sick. And so when they're in the hospital, all of our job as healthcare professionals is to help make them feel better. And so you just feel a sense of reward when you follow that patient throughout their stay, and you finally get to let them know that they're going home. So.
Man, that's great. That's great. Um, that's amazing that you were able to do that. Like just seeing it from the outside, like you're really practicing at the top of your license right there. You're not just knowing
Yeah.
what the meds are and just giving it out. You're really using your knowledge base that you learned at FAMU and
Mhm.
taking that and really like understanding the patient, understanding like what their needs are and serving them till they get better to get them outside of the hospital. That's great.
Absolutely. Absolutely.
All
Yeah.
right.